It is not uncommon for sufferers to have suspicious or paranoid ideas. For instance, they may mislay an item around the house, and because their memory is poor, when they can't find it, they think somebody else has taken it. Try to avoid outright disagreement or persuading them with logic, because these accusations are often very firmly held, and they may just get annoyed and more suspicious if continually contradicted.
What we often find is that the paranoid belief is very firmly held, and the sufferer may become even more agitated if disbelieved. It's also important to try not to agree with the false belief for a quiet life, as this may reinforce the idea and make it more likely to persist. Far better to empathise, gently reassure, or try distraction. Sometimes, if this does not work, medication may help.
Well, Don was very suspicious of me all the time. I was spending his money, which came in because he was very money mad at times. I had to account for every penny. I couldn't spend on various things because they cost money. Even now when I go in to see him, he'll say, "How much does it cost to get you here? Or how much are they charging you for my staying here?" I would try and answer with just say, "Well, social services are paying for it. It's all right, you can have what you want." He didn't have any money on him, so I just used to use a piece of paper and put £5 on, £1 on, and I'd give him some loose change. He was quite happy with that.
There are medications that may help with suspiciousness. One commonly prescribed group of drugs are called antipsychotics. These drugs should be used only after other techniques have failed, or the person's ideas have become very distressing to themselves or others. They should be started at very low dose to avoid side effects and be regularly monitored by the health professionals prescribing them to adjust the dose and monitor for side effects. It is often possible to stop them in a few weeks. Always remember to ask about possible side effects and what to do if they occur. Antipsychotics should be used with great caution in Lewy body dementia. There are other drugs such as Aricept, Reminil, Exelon or Abixa that are also occasionally prescribed for these symptoms. If you find you are struggling to make headway on your own, talk to your GP or community mental health worker to explore what else can be done and whether medication may be useful.
Sometimes people with dementia will seem to fill gaps in their memory with old memories as if they were currently happening. For instance, their parents still safely looking after them, or else they seem to fill them with imaginary events. We call this confabulation. Often these will be a source of comfort to them to reduce their stress, so don't feel you have to challenge them, and advise other members of the family or visitors to do likewise.
Even though it may feel like the right thing to do, try not to argue or collude, but use the stress-reducing techniques previously described, such as keeping calm and distraction. Medication does have a role, but try other solutions first.